Kaohsiung Veterans General Hospital, Da Vinci Surgical System. The greatest fear in undergoing major surgery is ending up with a large and unaesthetic ugly wound. In addition to worrying about being bedridden for several days and unable to successfully return to normal daily life. Kaohsiung Veterans General Hospital offers the Da Vinci robot-assisted minimally invasive surgery, which leaves patients with the most precise and smallest wound and the shortest recovery for discharge. Da Vinci surgery can be said to be the best surgical option for people living in modern times.
After this operation, Da Vinci surgery was done, I could get out of bed in 2 days. You could even say just after 1 day, I didn't feel much pain. My condition was very good. About half an hour after the urethral catheter was removed, I could urinate smoothly. Functional recovery, for example, the function of urination. People need to urinate every day. If unable to control urination, that will be a big problem. Another important issue for men is erectile function. My physical recovery got better and better. Now I feel like a man. Very grateful to Director Yu and his wonderful team. They allowed me to be reborn, gave me a new lease on life. Thank you so much. It can only be expressed here. I mean, thank you again. Thank you.
With 3D HD ultra-high resolution vision and through the robotic wrist, physicians can perform extremely subtle movements and adjustments, mimic real wrist surgical instruments, and operate on hard-to-reach areas in confined spaces. I feel that, to tell the truth, I haven't really had any surgeries in the past. This time, I feel that the Da Vinci surgery is really advanced. And not only is the wound small, sometimes I can hardly see it.
Doesn't feel like it was such a big operation.
Because the next day I went for a walk in the park nearby. I got up at noon and went for a walk, and I was discharged in 3 days, including the day of the operation. I was discharged very quickly, and my mental condition was good. The wound was very small, recovery was quick, and I could walk on the second day. Is it possible not to cut it open like my mother? I think it's ugly. The doctor said, yes, there's Da Vinci surgery. Da Vinci surgery like mine, although I have 6 small holes, but the length of them combined is less than the length of my appendicitis wound.
Da Vinci surgery has several arms. In fact, its arms are just like our wrists. We can turn our wrists. That relies on our hands. The hand on this control platform, this angle, is where we can suture in very difficult places. Suture very well.
Actually, I could get out of bed the next day, although I didn't pass gas the next day, but I knew that I was conscious. When I could say the first sentence, I asked, "When can I eat?" because I had a strong desire to eat.
Doing some more flexible sutures is very easy on the Da Vinci, but with general laparoscopy, it's very difficult. Da Vinci surgery has a relatively new feature. It's 3-dimensional. You can see how far away it is. Then comes its magnifying effect. It can magnify more than 10 times. That's a great advantage for people like us who have myopia.
It only requires a tiny incision for the robotic arm to enter. Then it can perform complex and delicate operations, reduce infection and complications, protect healthy tissue, avoid unnecessary damage to blood vessels and nerves, and also reduce surgical bleeding and pain. Back then, my neck just suddenly grew this strange thing. I didn't notice it. It was my mother who noticed and asked, "How come there's a lump on your neck? It is such a big lump. Looks like the Adam's apple of men." When I went to the otolaryngology department of Veterans General Hospital for a routine examination, I had Dr. Sue take a look. Dr. Sue said it was a thyroid tumor.
In our country, thyroid cancer is the most common head and neck cancer of women. The initial symptom is lack of obvious discomfort. It's usually discovered incidentally, having a hard lump at the anterior lower neck. We use surgical treatment, The prognosis is very good. If the tumor is detected early, the patient can survive a very long time. 20 to 30 years shouldn't be much of a problem. One of the risks of thyroid surgery is the damage of nerves. It may cause hoarseness or swallowing problems. On the other hand, traditional surgery cuts the anterior lower neck, which will inevitably leave some scars. So if you don't want to have scars on your neck, the Da Vinci surgery is a recommended solution. Being the most advanced endoscopic system, it can enter through the armpit incision and then into the neck. First, the wound will be changed from the neck to the armpit. Second, by using the unique endoscope, all the nerves can be clearly seen.
After the surgery, I feel the result is very good. I don't need to cover up my neck with clothes for fear that people may see a scar on my neck. The recovery also went well, so I'm very satisfied with the surgery. In addition to its application in the Department of Otorhinolaryngology Head and Neck Surgery, Department of Urology, and Department of Obstetrics and Gynecology, the Da Vinci robotic arm minimally invasive surgery is also used in the Division of Cardiac Surgery, Division of General Surgery, Division of Colorectal Surgery, and Division of Thoracic Surgery, etc., and will continue to serve patients and help them regain high-quality, healthy lives.